Welcome to the RLSS UK AED Awareness training video. This short video is designed to help you understand what an AED is and how it is used to save lives. Automated external defibrillators, AEDs, are devices that deliver controlled electric shocks to allow the heart to try to beat normally. The majority of cardiac arrests are due, at least initially, to an abnormal, fast, irregular beat of the heart known as ventricular fibrillation, VF. Electrical defibrillation from an AED is well established as the only effective treatment to terminate VF and allow the heart to beat normally. You should only apply the AED pads to casualty's chest if they are unresponsive and not breathing normally, and in all cases call 999 or 112 for emergency help. The delay from collapse to delivery of the first shock is the single most important determinant of survival. If defibrillation is delivered promptly, survival rates as high as 70% have been reported. The chance of successful defibrillation declines at a rate of between 3 to 5% with each minute of delay before a defibrillator is used. CPR will help to maintain a shockable rhythm, but is not a definitive treatment. Having an AED within the facility and a trained team to respond helps to keep the time taken to treat a casualty to a minimum. Due to the cost effectiveness of AEDs, including their maintenance, many facilities now have AEDs on site. The location of an AED should be indicated with clear signage. Using an AED is easy. They have been designed to be used safely and effectively by members of the public. Some AEDs turn on automatically when you lift the lid, others you need to turn on. Most AEDs give you clear instructions that you can follow. Let's take a look.
Apply pads to patient's bare chest.
AED pads should be placed in the two positions shown. AED pads should be applied to a casualty's bare chest. This may require you to remove or open the casualty's clothes on the upper body, dry the casualty's chest where the pads will be placed, shave any excessive hair to ensure the pad will stick, move jewellery out of the way, or remove plasters in the area where the pads will be placed. It is important that the AED pads are placed in the position shown. This is the shortest and fastest route through the heart.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Once the pads are in place, you should plug the pads into the AED and allow the AED to analyse the casualty's heart. It is important that no one touches the casualty, including you. Ask everyone to stand clear.
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
Stand clear.
If the AED has found a heart rhythm that needs to be shocked, it will tell you to press the shock button. If a shock is needed, you must ensure everyone is clear and no one, including yourself, are touching the casualty before pressing the button. After the shock is given, you should start CPR. If no shock is needed, you should start CPR.
Shock advised. Charging. Stay clear of patient. Deliver shock.
Shock in,
now.
stand
Shock
clear.
delivered. Paused. Start CPR.
There are some important safety issues to remember when using an AED. Do not touch the casualty during analysis, charging, or the delivery of a shock. This is the same for any bystanders, and especially during the delivery of a shock. Shout, "Stand clear!" and check visually that no one touches the casualty. Let's see it all together.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
Stand clear.
Shock advised. Charging. Stay clear of patient. Deliver shock.
Shock in,
now.
stand
Shock
clear.
delivered. Paused. Start CPR.
There may be situations when someone is giving CPR when you arrive with an AED. This video shows clearly how you would use the AED.
The ambulance is on its way. We're at the defib. Carry on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
Stand clear.
Shock advised. Charging. Stay clear of patient. Deliver shock.
Shock in,
now.
stand clear.
Shock.
Community Public Access Defibrillators, CPAD. CPADs are coded cabinets which are usually located on a wall outside of a building or sometimes located in telephone boxes. These CPADs are usually available 24 hours a day, and to gain access to these defibrillators, you will first of all need to call the emergency services. If the CPAD location has been registered with the emergency services, they will provide you with a cabinet code for you to access the defibrillator. Thank you for watching this video. Please remember, hands-on training is beneficial to allow you to practice these skills. Training can be delivered by RLSS UK trainers. Please contact us if we can help.